Good morning, everybody. Good day. Welcome to Dental Voice on the Case with Xyrus. My name is Rolando Mia. Today, we have a really special guest, and oh my goodness, I'm so excited to introduce you to Dr. Warren F. Gabarée. He is the head of the dental programs at Coastal Carolina Community College and recently shared some incredible things with us regarding just what's involved with education, dental hygiene, dental assisting, and dentistry. So I'm not gonna, no spoiler alert here. I want to introduce Dr. Warren F. Gabarée. Good morning, Dr. Gabarée. How
Uh,
are you?
Good morning, Rolando. I am well, thank you. It's I just really appreciate the opportunity for you to invite me on to your show. I'm a little nervous, but I think that's a good thing. I always tell my students it's better to be nervous than not care.
No, absolutely. First of all, thank you so much for joining us. I want to share everybody that Dr. Gabarée is a fellow South Coastian Californian or something. As it turns out, he used to work up in Santa Maria, right around the left side of the country, and is now at Coastal Carolina. So that was kind of cool to see. So before we begin, I'd love to understand just a little bit about your program, and you provided us with a couple of slides about it. So would you please, if that's okay, kind of take us through what's at Coastal Carolina before we jump into kind of your vision for how to enhance and kind of challenge dental hygiene and dental assistant education. Is that cool?
I would love that. I would love that.
Cool.
So this is the entrance to the college. When I see this picture, I'm reminded of the excitement I had on November 8th in 2017 when I arrived for my interview, and it's just brings back exciting memories, and I'm still excited about being here. So that's the great team that I have the pleasure and distinct honor of working with every day. Those smiles are real. They are truly enthusiastic, talented, and solution-driven team. And it's just a joy to be working with them, particularly through this last 18 months with all the challenges of COVID.
Now, who are each one of these people?
So that's Kyle Morgan. He's one of our full-time faculty with dental assisting. The next to him is Jennifer Robinson. She is full-time and is in both our dental hygiene and dental assisting programs. Erica Spring is our lead first-year dental hygiene section. And then next to her is Sabrina Bruton, who is our lead for our second-year students. And then that is me, and Shelby Chadwick. Dr. Shelby Chadwick is next to me, and she is our lead for our dental assisting program.
I love it. I know that there are a lot of other folks behind the scenes who are really working hard, but really appreciate getting to know your team. Thank you for that.
Thank you. So that's our sign when patients walk down the hallway. They lets them know that they've arrived at the dental clinic. And then the next slide, you'll see our clinic. We have 19 operatories and 4 X-ray rooms. And our clinic has a lot of age on it, but we have an amazing facility and maintenance team here at the college. And it's just always running smoothly, running well, and they keep everything in just amazing shape. So that's the clinic. So this is what I call our 18th century learning center. This was our original dental materials lab. I mean, it served us well, but I've had the distinct honor on my watch to in January we demolished that and created the next slide, which is what I call our 21st century learning center. This is our new sim lab, and it is just absolutely amazing. And if I may, Rolando, I'd just like to comment. So this is a visual of the kind of support that I have from our college administration team, President Heatherly and his executive team are just amazing. I'm a very fortunate dental department head. And then along with our division chair, Chrissy Stewart Horton, they just really make a way for us to really provide innovation and exciting learning experiences for our students. So this is the showcase in my mind.
That is fantastic. Thank you for sharing that. In with regard to any industry, education is incredibly powerful and important because it kind of sets the foundation and it also sets kind of the future. So I'm really, love to hear your vision. And you started sharing it early on, but I think it's important for our viewers with regard to kind of how to set up dental assistants, dental hygienists for success in the future. Also, how to challenge kind of the status quo in education. So, how would you kind of present that right now, and what's the message you want to get across?
Well, for us, when I got here 3 years and 8 months ago, and I like to just kind of live with an organization to see their personality, their character. I don't like to come in, oh, I got the answers. And after a while, I was able to really, kind of learn everybody's personality, see the team I was working with, and the administration, and then I just sat down with everybody and I said, how might we provide a engaging and very challenging and profitable learning and experience for our students, so that they would then go out and provide quality dental assisting and dental hygiene, and be real assets to the team for their future employers. And we sat down, we kind of talked about things, and we decided that we wanted to make our vision creating tomorrow's syllabus today. And I actually saw that in one of the alumni magazine of my high school, and I thought that's what I want. That's what I
So
want Coastal Carolina to be known for.
that is amazing.
That out.
If I were to ask you, Dr. Gabarée, when you sat with your team and you identified how to do that, what would you say the biggest problem, if amongst many, but the biggest issue that dental hygiene and dental assistant education is facing today? What would you say that would be?
Well, I think, like any organization, what I was asking for was the freedom to look for a paradigm shift.
Mm.
And dentistry is a very stable profession. We don't change. I mean, we like to say we change, but when you really look at it, we don't change a lot. We haven't changed a lot. I graduated in 1972, and we made some great changes, but I wouldn't say they were earth-shattering changes. So, and dental education, from dental school, dental hygiene, dental assisting, it's kind of well, this is the way I was trained. It worked well. So, we should train everybody else like this. So that was probably the biggest paradigm shift that I had to address. But thankfully, I'd earned the trust, and I had credibility among our faculty. And I told them, if you decide that I am totally wrong, then just tell me, and we'll go back. But if you could just please kind of take this journey with me, and let's see where it goes.
It's amazing because in looking at dentistry, and if you're looking at the different functions in dentistry, dentists, dental hygienists, dental assistants, there's been, at least and correct me if I'm wrong, kind of a siloed approach with regard to the way people are seeing that. And from what I understand, and based on what you'd shared, you see it as more, or needing to be a lot more collaborative in regard to the engagement. Is that kind of the vision or context?
Absolutely, Rondo. I tell my students all the time. So one of the things is I have purpose to teach courses both to the dental assisting and to the dental hygiene students. I feel it's an opportunity for me to build relationships with them. It's an opportunity for them to build a relationship with the dentist in a really safe, educational environment. And it's an opportunity, I feel, for me to help them build confidence. And what I tell them is that dentistry is a team sport, and they play a very vital and important role on that team. I'm not a football fan. I don't even know how to play football, but
What?
you excuse the sports analogy. It's like the dentist, I'm the quarterback. But I can't play every position, right? Every team needs a good quarterback, but they also need, I think they call them end linemen or whatever, all those things.
Right.
But everybody
Offense,
has
defense.
an
Exactly.
absolutely essential role. So I tell them dentistry is a team sport, and I spend time helping them realize that they have a critical and very important role. And I want them to feel confident in knowing that what that role is. And I tell them, you might not get the best job right out of school, but I want you to know you have options, and you just keep looking for that perfect and that employer that you can be respected and you can be who you are as a critical part of the team. So, that's I love working with young people, and I feel like part of my job is to help stimulate wholesome thinking in them, and particularly about where they fit into this whole dental team.
So I love the sentiment, and the message behind that is huge. Coming in as a seasoned, mature, I'm going to call it dentist who's got experience. How do you bridge kind of that? Oh, he's the dentist. Obviously, that's what he's going to think. Or how do you kind of overcome that, and how do you kind of get connected with? Because, and to kind of touch on the elephant in the room, there's been a lot of talk about friction between the teams, the dental assistants, hygienists, and the dentists, especially with the advent of COVID. And how do you kind of bridge that? What's the perspective around that?
So I agree with you. I think I shared with you before that there's always been a love-hate relationship between dentists and particularly dental hygienists. I think COVID has really created the perfect storm, and it's sad to see what's happening. I think also dentists really, they say, we say we appreciate dental assistants, but I don't think it really demonstrates itself in the way that I think it should. So to answer your first question about how do I bridge that relationship, I'll share a funny story with you. I was a part-time instructor in Santa Maria at Allen Hancock College in the dental assisting program for 15 years. And so, they do assessment, they do surveys with the students, and, and you get rated as an instructor. So one year they did that, and my boss came to me and she showed me them, and all the students said that I was hard to talk to. I was unapproachable. I mean, I was like crushed. I was like, oh my gosh, it's like, and I went home to my wife. I said, how can this be? And so I went in the next class, and so my wife, I'm originally from Boston, so we had this lobster hat that I had gotten in Boston. So I went in the next class, and I kind of had this hidden, and I said, my feelings were hurt. I said, I can't believe that you think I'm unapproachable or anything. I said, so from now on, I want you to think about me as this. And I flipped on the lobster hat, and I said, and everybody just cracked up. And I said, so if you think I'm unapproachable, just think about this guy here with this silly lobster hat on, and I'm no different than anybody else. So please, and it worked. In fact, just last week I did the same thing with the dental assistants here, only I put on this silly fisherman's hat because again, there's that the doctor kind of thing, and I just try to break that down. So
Sounds
um,
so cool. So, what are some at Coastal Carolina? Are there any examples of students, or how you're helping them overcome some of these, some of the hurdles? Because there are perceptions that people come in, and there's it's not easy, right?
right. So one of the things I consistently incorporate into my teaching is I talk to the students about visual intelligence, and so I tell them their eyes are very important, and I talk to them about building a database. I go, a database, is where people pull information and are able to process things. So I talk to them about building this database, visual intelligence, and then I tell them that my goal is to create a discipline of thought in them, so that when they see things, when a dental assistant sees certain things, she knows what's to follow or what to do. And when dental hygienist sees certain things, that their mind starts to work in a certain way. And I say, and tell them that makes you a critical part of the team. I go, legally, as a dental hygienist, you're not allowed to diagnose. I said, but when I come in and I sit down and say, okay, what's up? I'm asking you for your assessment. And we actually create that environment in the clinic here. I'm in the clinic 2 mornings a week. I do exams with the students, and so we get to live this out. And so again, my goal is to create confidence in them, so that they feel and appreciate who they are, so that then they walk into the room confident, not on the team.
So,
And then,
oh,
remember you asked me about somebody in particular. So, you want me to give you that, or?
no, yeah, that would be great. We had a quick glitch there, so I missed a little couple of seconds of what you said there at the end. But
Oh, okay, so I was just saying that being in the clinic, I actually live out, and we actually, get help them create that confidence. So
awesome.
to answer your question about specific example, so we have a student, and he's our only male student in our second
Hmm.
year program. And last year, he's very bright academically, but he really had a hard time um, uh, doing clinical skills. He's an athlete, and I just couldn't understand, and I wrestled with how can I help him. And it actually led me to look at augmented reality and virtual reality, and ended up we have a relationship with a company called Z Space, that is one of the leading companies developing augmented and virtual reality in the career and technical education environment. So I reached out to Z Space. They were excited. I talked with our student. I told them, we worked with them, coached them. Mrs. Springs worked with them closely. What we found out is we needed to help them develop muscle memory and refined motor skills. And so anyway, Z Space, they ended up coming out, and I had the student. They have some amazing technology, and I saw it work in the welding industry, where they had a stylus that actually functioned as a welding tool. So we're in the process of working with them to see if we can develop a similar thing for dental instrumentation. The good news is our student is really risen to the challenge, and he is doing really well. And so, but again, it's just looking outside the box and seeing what's available.
That's so cool. I appreciate the you sharing that story. Now, talking about technology, one of the things that you shared with us earlier on is that, you know, and you mentioned it earlier on during our discussion that, you know, dentistry has been around for a long time, and just because it worked doesn't mean it's what you have to do. It's definitely foundational. How does technology and how does innovation factor into all of this, and what are some of the things you're doing around that?
Okay, so I was hoping you'd ask that question. So I really this is really exciting me. I love the title that you put together: collaboration, innovation, and new technology. So so to me, this really captures our vision of change by design. Change by Design is the title of a book by Tim Brown. I highly recommend it. It has had a huge impact upon my life in structuring my thoughts as to how to direct and lead change in our organization. But so so what we've done is that we've all these three things that you mentioned: collaboration, innovation, and new technology. They are all integral and distinct pieces of a very important whole. And so together, they help us create that, vision of ours, create tomorrow's syllabus today. So with with this strategic game plan, we can actually incorporate those together. So the technology. So we have a question: how might we, create this environment, learning environment? So then, as we pursue that, how might we question? We look at technology, and we discovered new technology that was going to facilitate our ability to do that. That new technology ends up facilitating innovation in our syllabus, which allows us to create tomorrow's syllabus today.
There you go.
And so it fuels what we're trying to do here.
Now, you shared
Sorry to
with
get
me.
so excited, but
No, this is cool. You shared with me this, I believe. This is one of the new ones, right?
all right. So this is so in addition to Z Space, and in addition to Xyrus, we also have a collaborative relationship with EMT Dental, which is a Swiss company, and they have developed a treatment protocol called guided biofilm therapy, GBT for short. So this therapy focuses on allowing us to do a risk assessment on an individual patient basis. So in collaboration with their GBT, they also developed this technology called Air Flow Prophylaxis Master, which to me is an incredible paradigm shift as far as how to do hygiene. So we, through the support of our division head, and then from our administration, we were able to purchase 7 of these units for our clinic. And EMT tells me that we were the first dental education program in the world to train our students with using this technology. So it's pretty exciting just to have that classification.
That is so cool. That we just recently had one of our guests, Amanda Hill. She's an RDH, did a system with guided biofilm therapy using the same system and our system. How do you see those working together, and or do you?
Well, so they work extremely well. So again, as I mentioned, one of the other companies, innovative companies that we've built a relationship with is Xyrus, and particularly your Isovac. So I feel we have a responsibility as an educational institution to really address the dental aerosol risk management issue.
Mm.
And so, so through our relationship with Xyrus and your amazingly generous DEPP bridge program, we are training all of our dental hygienists to use Isovac on all the time. And the reason is because Isovac allows us to truly train our dental hygienists on two-handed dental hygiene, which to me is a critical way uh, train them on dental aerosol risk management. And so it's just very exciting. I think two-handed dental hygiene
Right.
is as much as a game changer as four-handed dentistry was and sit-down dentistry was. And so we want our students to be not only proficient, but to be disciplined and to have the discipline of thought to know that this is a critical part of the way they need to practice dental hygiene. And thanks to Xyrus, they'll be able to take their own isovac with them, so they don't have to depend on a dentist to see the light. They just need to talk them into buying the mouthpieces. So I'm very, very excited. And of course, it complements the airflow prophylaxis master, because it also helps mitigate that dental aerosol. So it's just an amazing partnership. Sometimes I can't. I'm having so much fun I can't stand it.
Well, I could spend the rest of the day talking to you, and I love the energy that you bring. I love the perspective from both from the dental side, dental hygiene, and the dental assisting side, and I think it's so important that we incorporate that, we drive that collaboration. The sentiment or the context around we're on this team together is huge, and starting out your students from that perspective, I think, is absolutely game changing in and of itself, because now they're not entering thinking, wait a minute, no, this is part of a team. If I were to ask you, for our viewers, for the folks who'll be watching this, what is as a way to bring this back together and kind of close it out, what advice would you give to other educators out there, and then students or people considering the hygiene profession or the dental assisting profession? What advice would you give them based on everything that you've been doing and seeing?
Well, I would first say that dentistry is an absolutely amazing profession. I tell my students all the time that we are one of the fortunate professions within the healthcare industry that we actually are able to build long-term relationships with our patients. And those personal relationships are really, you can't replace those. And, it's really missing a lot in our society sadly today. So it's a wonderful, wonderful profession. Dentistry has done an amazing job. I was there with AIDS, and dentistry rose to the occasion, and we upped our game in infection control. And I believe that we have led the way in infection control, since then, and we continue to do it today. So I think it's a wonderful profession. It's rewarding. At the end of the day, you can look back and see what you did and what you accomplished. It's not like some where you can move a few papers around, but if somebody asked you what you do today, it'd be a hard time to say exactly what you did. But dentistry allows that, and I think through the realization of COVID, and that dentists are much more appreciative of dental assistants and dental hygienists. And I think together, we all need to just continue to work so that we truly embrace dentistry as a team sport. So,
Oh, that's fantastic. Thank you so much for that. If people wanted to contact you or ask you questions, what would be the best way to do that, Dr. Gabarée?
I guess the best way, not really, I always love personal communication and talking to people, but probably the best way would be through email, and then we could kind of go from there. And so my email would be gabareew@coastalcarolina.edu.
Fantastic. And if people wanted to understand Coastal Carolina, go to the Coastal Carolina website, correct?
Right. And just look up dental programs, and you can find us there.
Excellent. Excellent. Well, first of all, Dr. Gabarée, thank you so much for taking the time to share that with us. Love the perspective. Your students have an incredible leader and an incredible team of leaders, and I'm so looking forward to seeing the successes that they're doing, and some of the wild and cool things that they're challenging, how they're doing that. I love the story about your student who was struggling and is now overcoming. Anytime you hear that, that's excellent. At some point here, would you like to join us back and kind of share with us how things are going?
I would love to, Rolando. And again, I want to just thank you for the opportunity. And I just really publicly would like to thank Xyrus for the investment they're making in our students and just in our program and helping us really, develop the tomorrow's syllabus today for our students. So I can't really, words don't express my appreciation.
Well, thank you for that. And thank you for joining us. Hey, folks, if you like this content, please share it. If you have questions for Dr. Gabarée, please reach out to him. If there are things that you'd like us to focus on or spend time or answer, please let us know. Dr. Gabarée, thank you so much for spending time with us. Have a wonderful and safe rest of your weekend. I look forward to watching you just completely, blow the roof off of this. Excellent.
You as well, Rolando. Thank you again.